2022 was supposed to be a triumphant year for China and its leader Xi Jinping, as he began his second decade in power with a pledge to restore the nation to greatness. Instead, China had its most difficult year under Xi's rule as it reeled from his costly zero-COVID policy, from months of overzealous enforcement that crushed the economy and stoked historic public discontent, to a wholesale abandonment so abrupt that left a fragile health system scrambling to cope with an explosion of cases. The chaos and disarray is a stark contrast to the start of the year, when Beijing showcased the success of its COVID containment measures by keeping the coronavirus largely at bay from the Winter Olympics. Over the span of a year, Xi's hallmark pandemic policy has turned from a source of legitimacy for the ruling Communist Party into a spiraling crisis that threatens to undermine it. As an unprecedented wave of infections and deaths sweeps the country, many have questioned why, after sacrificing so much under zero-COVID and waiting for so long to reopen, the government ultimately let the virus rip through a population with little prior warning or preparation. In its tightly sealed, meticulously managed Olympic bubble, the ubiquitous face masks, endless spraying of disinfectant, and rigorous daily testing paid off. Any infected visitors arriving in the country were swiftly identified and their cases contained, allowing the Winter Olympics to run largely free of COVID even as the Omicron variant raged around the world. The success added to the party's narrative that its political system is superior to those of Western democracies in handling the pandemic, a message Xi had repeatedly driven home as he prepared for a third term in power. It also boosted China's confidence that its well-honed zero-COVID playbook of lockdowns, quarantines, mass testing, and contact tracing could build an effective defense against highly transmissible Omicron and contain its spread. In the lead up to the Games, these measures worked in January to tame the country's first Omicron outbreak in Tianjin, a port city near Beijing. Then, on December 7th, the central government announced a drastic overhaul of approach, rolling back lockdowns, testing, and allowing residents to isolate at home, effectively abandoning zero-COVID. State media and health officials have since flipped from preaching the dangers of the virus to downplaying its threat. While the easing of stifling restrictions is a long-awaited relief for many, the abruptness and haphazardness of it has caught an unprepared public off guard and left them to fend for themselves. Over the counter-cold then fever medicines, which had been restricted from purchase under zero-COVID, sold out instantly at pharmacies and on online shopping sites. Huge lines have formed outside fever clinics and hospital emergency rooms overflow with patients, many elderly. Crematoriums are struggling to keep up with an influx of bodies. Amid the chaos, the government has stopped reporting the bulk of the country's COVID infections and narrowed its criteria of counting COVID deaths in a way that the World Health Organization warned would very much underestimate the true death toll. While that move has taken the public's panic into consideration, the political undertones are also hard to miss. For nearly 3 years, China's low COVID caseload and death count compared with countries like the United States had been held up as a measure of the party's merit and legitimacy. Now, the true scale of the outbreak and deaths could deal a serious blow to the credibility of a government that had justified years of painful restrictions on the grounds that they were necessary to save lives. Some studies have estimated China's abrupt and under-prepared reopening could lead to nearly 1 million deaths, close to the COVID death toll of the US, as China enters its third and darkest pandemic winter. Zero-COVID is finally dead, but the fallout from its demise will haunt the country into the next year.